What do you think of when someone says hand hygiene? A study done in the UK showed that 95% of the public fail to wash their hands properly and do not know the proper methodology either. Hello, my name is Stanford Shin, and our research was centered on the knowledge of hand hygiene between dental healthcare professionals. Our group members include Robert Hisa, Michaela Lopez, Thang No, Sarah Pack, Araya Perez, and our advisor, Professor Hayton. Proper hand hygiene is extremely important in a field like dentistry, where there are constant hand movement and physical interactions with patients. It is imperative that healthcare professionals are aware of the need to reduce bacterial growth and harmful pathogens that could negatively affect a patient's health. Maintaining clinical asepsis is central to the issue of preventing disease transmission, especially with the onset of COVID-19 pandemic. The need to know and maintain proper hand hygiene has never been more important. Since many dentists operate their own private practices, each will ultimately have their own unique and varied form of asepsis protocol. This can lead to differences in the level of asepsis, knowledge, and technique. Our research will be exploring the significance of these differences. Michaela will now be talking about our goals and hypotheses.
The goal of our research project was to address certain perceptions that those involved in the dental profession might have on asepsis techniques. We wanted to do this by testing the knowledge of level of hand hygiene from three different dental professional types. These three groups are dental professionals, dental professors, and dental students. We define dental professionals as clinicians who work primarily in dental offices. We define professors as those who work more than 80% as a teacher. Then we define dental students as dental students and dental hygiene students. The purpose of our research is on emphasizing how important understanding hand hygiene is in a dental office. We not only wanted to see how much our participants understood about the topic, but hopefully make them aware of what areas of knowledge they might want to improve upon. Those objectives were accomplished when we addressed the following aims. One, determine the level of knowledge for hand hygiene currently among dental professionals, faculty, and students. We hypothesized that the overall percentage of questions answered correctly among the three groups on proper hand hygiene would be less than 50%. Two, determine whether there is a difference in the level of knowledge for hand hygiene when comparing dental professionals, faculty, and students. We hypothesized that there would be no difference in percentage of questions answered correctly among these three groups. Araya will now go over our materials and methods for this study.
This image underneath materials and methods just shows the progression of our study. The questionnaire that we use is an adaptation of a previous study that was conducted by Thicker and Pradeep in 2015. With this prior information, we created a cross-sectional survey. There were 14 questions that were inputted in Loma Linda University School of Dentistry's online survey platform called Qualtrics. This survey included questions on hand hygiene knowledge as well as our participants' demographics. We sent the survey out via email to three groups that Michaela mentioned for us: dental clinicians, dental professors, and dental students. Once we gather the data from our participants' responses, we analyze the proportion and frequency of our desired responses. We use a chi-squared analysis in order to cross-tabulate our data to determine the significance of our results. And now Robert will be going over the first part of our results.
So one of our main results is displayed in figure 1, which shows the overall percent scored correctly among all the participants. A one sample t-test was conducted to determine if there was statistical significance in the percentage scored. Sample size of 103 and a p-value of less than 0.001 indicated that the overall percentage scored, which was 65.1%, was statistically significantly higher than 50%. In figure 2, we compared the percentages scored correctly between the three different groups. Clinicians scored the highest with a mean of 66.6%, followed by faculty at 65.3%, and the students scored the lowest at 64.5%. We ran a Kruskal-Wallis procedure, and a p-value of 0.056 indicated that although there is a difference among these three groups, this difference is weak and not statistically significant. And Sarah will continue with the rest of our results.
So figure 3 just shows us how well the different age groups did with the survey answering each question. While this was not our hypothesis, we thought that it was interesting that those over 65 scored the highest at approximately 74.7%, and those ranging from the ages of 50 to 64 scored the lowest with 61.5%. Figure 4 was also not part of our main two hypotheses, but we wanted to know which questions that our participants tended to get wrong the most. Participants scored less than 30% on two of these three questions. You can find these questions in the reference table at the top right-hand corner of our presentation board. Question 9, part 3, was on hand hygiene actions that prevented transmission of germs to the patients. It asked if you needed to wash after exposure to the immediate surroundings of the patients. The answer was no. However, only 22.82% answered this correctly. For question 10.3, only 28.9% of the patients or participants answered this question correctly. And for question 8, only 41.6% of participants answered this question correctly. Now Tang will go over some more things that we have learned from our study.
With the result that we found, we reject our first null hypothesis, as the overall percentage of questions scored correctly was 65.1%, which was statistically significant higher than 50% with a p-value less than 0.001. We failed to reject our second null hypothesis as there was no statistical significance in the difference of percentage answered correctly among the three groups with a p-value equal 0.056. In conclusion, our research found that despite the perceived disparity between different culture and environment in the asepsis procedure, when given a standardized test on the subject, dental professionals were generally knowledgeable about the correct hand hygiene methods. The statistical importance of the results show that dental practitioners not only practice the right treatment for asepsis, but also apply this information while working in dental clinical environment with patients. Throughout this research, we find that potential direction of this analysis will be to compare the findings before and after COVID to see how the pandemic result in improved understanding and knowledge of the correct asepsis protocol. We hope that this research will offer insight in strengthening the fight against disease transmissions. Thank you so much for listening to our presentation.